Thanks for staying with us on DD India. I'm Sakal Bhatt and you're watching Doctor's Chat, a special COVID series. Well, today we're going to examine three big questions. Why are frequent mutations seen in SARS-CoV-2 virus? Having said that, when will these mutations stop? We're talking about vis-a-vis COVID-19. We're also going to talk about the efficacy of the available vaccine, the current vaccines that are available, their efficacy on these variants or on these mutations, and also the third big question, what really makes the unvaccinated most vulnerable vis-a-vis the variants that we have, vis-a-vis the mutations that will continue to take place for some more time till the pandemic remains. And on this episode of Doctor's Chat, we have with us Dr. Saumtira Rawat. He's head of surgical gastroenterology and liver transplant from Sir Gangaram Hospital in National Capital. Thank you very much, Dr. Rawat, for taking our time for Doctor's Chat. And today, we're going to specifically focus and understand why does virus mutate vis-a-vis COVID-19, since this is our COVID-19 special series, and why, having said that, these mutations are a matter of concern because we know we have Delta plus, Delta variant, Delta variant concern, all those things. So why does a virus mutate, and help our viewers to understand this aspect?
I think, first of all, thank you very much, Sakal, for inviting me to your chat show. And it's a pleasure to be here.
Pleasure is ours as well, so thank you.
And virus mutate because virus wants to survive. As you see that, we are developing all the medicines, we have a vaccine. So, what virus does is it mutates so that it can survive. And majority of mutations, they are inconsequential. And some of the mutation can harm the virus as well.
Itself, yes.
So what happens every month, there is going to be 2 to 4 mutation or maybe more in the virus. And some of the mutation we don't even, concern about. But where the virus start acting slightly in a different way, the WHO has proposed, then it become virus of interest. And then when it behaves in a more damaging way, then we say it's a virus of concern.
Yes.
So to differentiate the virus of interest and virus of concern, for the virus of concern, there has to be a increased transmission. So that, when alpha wave came in England, you remember last year, in September last year, because I lived in UK and I was consultant there for 17 years. So, I keep a track of what is happening in UK. So when alpha wave came in UK, it was 50% more transmission of the virus. That is why it created a chaos in UK. Then it was a beta wave that was there in South Africa. Then it was a gamma wave, which was in Brazil in November 2000. And obviously, both beta and gamma wave, they created havoc in South Africa and Brazil. Then come to Delta wave, which came in India.
Okay.
So it became a virus of concern because there was an increased transmission. There is an increased virulence. That is why we say it is a virus of concern.
What do we understand by increased wavelength?
No, increased virulence, not
virulence. Okay.
Virulence. So virulence is to potential to induce more severe disease. So more patients will go to the hospital and more patients will go to the ICU.
Okay, let me ask you this. So what, let me interrupt you. I'm sorry for this, but we need to understand. What determines the severity of the mutation or the virus?
The severity of the virus is, suppose if the virus is causing havoc and is transmitting very frequently, so that, if at home only one, like, in the old time, you would see quite a few homes where one or two people were infected.
Hmm.
And when the transmission increases, you will see that majority of the household members get infected by the virus.
Hmm.
So
Hmm.
means
Hmm.
that transmission is higher and the virulence is higher. Then the third thing is there is a change in clinical presentation. You will have new symptoms. Okay. And the fourth thing is it is like what we call as a immunity escape.
Okay.
That is where virus will try to escape the vaccine or escape the antibody. That is called as a escape immune mechanism.
Hmm.
And last but not the least thing is diagnostic failures.
Hmm. Hmm. Hmm.
So that you would have seen in some of the patients of delta virus infection, they were negative initially, and later on they were found to be positive, or there were some of them where they were negative all throughout. They came to know when we did a CT scan of the chest, it is a COVID-19 infection.
Okay. Okay.
So these are the things which you need to consider, and then
Hmm.
you label the virus as virus of concern.
Hmm.
Obviously, what happened with Delta, there was a strong binding in the
Hmm.
receptor of the lung cells.
Hmm.
So obviously, it was slightly more virulent, and there was slightly escape immune mechanism. There was a wonderful study which has come out, I think it was yesterday or day before yesterday, where they had looked into patients who received vaccination, but then also they were infected in Delta wave.
Okay, okay, okay.
Yeah.
Is that also one of the reasons why we saw a certain pattern in cases in April and May? Because you talked about the receptor, lung receptor. So this particular mutant attacking a vulnerable respiratory tract. Hence, that was something which led to an unexpected, outbreak of cases where there were reported oxygen shortages in the hospital.
Absolutely, absolutely. There was oxygen shortages. There was lack of the hospital bed. Then there was a ICU also. There was a problem because a lot of people were requiring ICU
Hmm.
admission.
Hmm. Yes, yes. How often are are these mutations studied in India? I'm sure right now since you're also a part of the Supreme Court appointed National Task Force, I'm sure a lot of work is underway. Not really revealing the classified information, but for our viewers to really understand mutations is something we cannot escape, but I'm sure there's a lot of R&D that's happening simultaneously. The efficacy of vaccines that we currently have on these mutated variants, the dangerous ones.
I think vaccine is going to work. And obviously, if the efficacy of vaccine is, say, about 95%, it will reduce down slightly. But it will be working. And
Hmm.
what we have seen in our study as well, which came out yesterday or day before, and it was a very clear cut study where the mortality rate on the patient who were vaccinated was very, very low. So the
Okay.
mortality rate in the vaccinated group was 0.4%, and only 9 people out of 100, they require hospital admission. So
Hmm.
what happened, you will have an infection, but the severity of infection is going to be very less. So majority of them, they had a mild infection.
When you say mild, you mean asymptomatic or symptomatic but mildly symptomatic?
I think it's mild, means, very mild symptoms which can be taken care at home and
Hmm.
not requiring admission, so
Hmm.
that they don't have a drop in oxygen saturation. They
Hmm.
might have a, usual something like cough and cold, mild fever, which
Hmm.
will settle down in due course of time.
Hmm, hmm. Dr. Rawat, so what we do understand is that these mutations can have negative impact or maybe no impact, but there could be a positive impact also. Specifically vis-a-vis COVID-19 and SARS-CoV-2, what are the observations that we have as of now?
I think observation are that it happens when we sort of stop doing COVID appropriate behavior. So what happened when you stop having the COVID appropriate behavior, virus get a chance to infect people. That is what virus wants to do.
Hmm,
It only infect in a chain. So
hmm,
suppose if somebody is vaccinated, or if majority of people are having a COVID appropriate behavior, like when you are going around wearing a mask which is covering the nose and the mouth, then obviously virus cannot replicate. That is where the problem happens. And when virus can't replicate, then virus is going to die down in a due course of time. That is
hmm,
what is going to happen in due course of time when it's become milder and it becomes like influenza.
hmm.
But what happens when virus mutate and we keep our guard low, then virus get chances to mutate and increase the virulence and increase the transmission.
Hence also impact the efficacy of vaccines? Like if
When,
you have a broader immune system in place, so the transmissibility I mean, can it be minimized?
yeah, absolutely. What happened when the virus is sort of is having a immune escape? It
Hmm.
is not total immune escape.
Hmm.
I
Hmm.
think it is the immune escape from the antibody treatment, which is currently used in America, and it was started in India as well. But that we will know in due course of time.
Hmm.
But the vaccine efficacy remains, which has been proved in lot of studies in America, Europe, and India as well.
Hmm. So we have Delta, we have Delta Plus, and we don't know what's next. And at the same time, we're working on vaccines. Uh, if the virus continues to mutate, which it will, which also means that we will have to continuously work on uh, the vaccine, the composition of vaccine. I don't know how to put it technically, if you know what I'm trying to ask.
I think
It's
you are
work in progress.
Yeah, you are absolutely right. When I was in UK, every year I used to get a flu jab. So, to prevent the influenza. So that I think the similar thing is going to happen with the coronavirus as well. As we will have more mutation, there will be tweak in the vaccine. So, there will be
Yes, yes,
little
yes.
modification in the vaccine so that it will cover all the mutant strain as well.
Hmm, hmm. Okay. I'm just reading one of the research papers where it says every time these mutations change the way the virus behaves, a new variant of the virus is set to emerge.
Yeah,
So we don't have to worry. It's just that vaccinate and COVID appropriate behavior. I mean, that is all that we need.
absolutely, absolutely. There is nothing absolutely, it is all about, if we have a lack of COVID appropriate protocol or behavior, and if we don't vaccinate, that is like, you are going to increase the numbers.
So, does it actually boil down to one fact more, that it depends on my immunity or my immune system? Uh, that is what determines the impact of the variant. For example, if I'm infected with a double variant, it's a Delta plus. So, it depends on my immunity whether my body can handle that or not.
I think that is what I said. The most important thing is avoid the infection. To avoid the infection, you need to have a COVID appropriate protocol,
Mhm.
have a vaccination, and improve your immunity.
Hmm.
So, these things they work synergistically. So COVID appropriate behavior, vaccinate yourself whenever your number comes,
Mm-hmm.
and boost your immunity. And to
Yeah.
boost your immunity is like, have a healthy food, have a lot of vegetable and fruits, do regular exercises.
Hmm.
So that will boost your immunity.
Hmm. Hmm. Um, do you see a certain trend? I mean, what are the observations as far as the current study on these variants are concerned? What are the trends that are emerging? As of now, we do know it's in public domain. We're talking about it. That's why Delta variant. What else?
I think the mutation is going to carry on happening
Okay.
like like it was alpha, beta, gamma, delta. So
Hmm.
it's going to happen, carry on happening.
Hmm.
And WHO was pretty good in proposing a Greek alphabet to
Hmm.
pronounce the variant.
Hmm.
So that it's not like UK variant or Brazil variant or Indian variant. So it's going to be on Greek alphabet. As soon as the new variant comes, which is a variant of concern, is going to be given a particular name.
Hmm.
That is what is going to happen.
Okay. Dr. Rawat, there's a lot of talk about the anticipated third wave. Uh, there's a lot of information available in public domain. A lot of doctors, distinguished medical practitioners on this very show have vociferously advocated the fact that yes, it is possible to avert or not to have third wave only if we put our act together. How do you explain this? In terms of what we have right now, in terms of threat, in terms of the mutation threat.
I think besides the mutation, because we cannot stop the mutation.
Yes.
Mutation is going to happen, 2, 3 mutation a month. But the most important thing is avoid going out unless and until it's essential. When you go out, you need to have a COVID appropriate behavior.
Hmm.
And when your number come, you need to have a vaccine. And whenever there is a virus which is there in a particular locality, we need to have a mini lockdown and
Hmm.
have testing, tracking, isolation, and treatment.
Hmm.
That is what we need to do.
And testing, tracking, treatment, and Tika, vaccination. That's what our
Absolutely,
Honorable Prime Minister has
absolutely,
added one
absolutely.
more to the mantra. Yes.
Yeah.
So,
And, and,
yes,
and,
go ahead.
and also, whenever we are doing the unlocking, it's a human behavior. So we should do the unlocking in a graded manner rather than, having everything open in one go. It has to be graded.
Hmm. Uh, Overall mask usage has come down because we see increase in activity. Obviously, subsequent unlocking in the last 1 month, particularly, states went in a structured manner, and this is something which has also been observed by the health ministry itself. Uh, as a doctor, I mean, what could be a sustainable solution? What could be a sustainable solution? Uh, we cannot we cannot actually stop people's movement. Like you said, avoid going out, but that is again not sustainable. So, your thoughts on that?
I think what I'm saying is avoid going out means, obviously when you have to go to the work. What I'm saying is avoid going out to a party, to a marriage, avoid going out for a large gathering, any political rally, any religious gathering,
Hmm.
these kind, any social gathering.
Hmm.
Like we have seen that, a lot of, before the third wave came in, a lot of wedding ceremony was going on in February and March. And you have seen also that in a particular wedding, there were 200 people and 150 got infected.
Yes.
So when you have a mass gathering, that is where the problem will happen.
Hmm. And the kind of tourist influx you've seen in some of these hill stations recently, uh, visuals that have emerged really
There,
don't augur well. They
those,
don't augur.
those visuals were so disturbing, Sakal,
Hmm.
that it was really bad that, when you see those kind of visual, people not wearing the mask and then, roaming around, and it was very disturbing. And
Hmm.
there is a study that if more than 75% of the population is wearing the mask,
Hmm.
it's the next wave, even if it happens, is going to be flatter rather than reaching the peak.
Hmm. And what could explain that?
I think this is because what happened is the transmission, because we
Hmm.
are halting the mode of transmission by wearing the mask. If
Hmm.
less than 50% of your population is wearing the mask, then the risk of next wave is really high, and the peak will go a lot higher.
Hmm. Hmm. You know that mask that also reminds me this question of double masking
Yeah,
and Delta variant.
yeah. So if you are going in a public space, obviously double masking is better,
Hmm.
especially for the Delta variant. Yeah.
Hmm. Okay. Again, since you're also part of, I just mentioned the Supreme Court appointed task force, uh, what are the out of the box recommendations that you would like to share with the viewers, especially on the research front? Like you just mentioned yourself, mutations is something which we cannot stop, and I think we have a fair amount of idea as a nation, a sense that this is going to be our life for a few years at least, or maybe less.
I think the good thing is that we all 10 doctors and the health secretary and cabinet secretary, we are very proactive, and all the 10 doctors we are meeting regularly. And in the initial 1 month, we were meeting every day,
Okay.
and we gave a recommendation for the oxygen.
Hmm.
We have given recommendation for the research. We have given recommendation for pediatrics as well.
Hmm.
So things are going well, and I must say and congratulate government
Hmm.
that they are very proactive, and they are taking all the recommendation very seriously, and
Hmm.
lot has been done by the government.
Hmm.
When we realize talking to them that when we are discussing our recommendation, and the government and the health ministry is saying that we are already doing it, and lot has already been done. So here in Corona, we are all together. It's not that it's you versus me, or we are all together, and that is where and that is how we will win.
That's very reassuring, Dr. Rawat. Final words. Uh, that those who are not vaccinated are vulnerable. B, that whatever vaccines are available with us, there is no doubt on the efficacy of these vaccines as far as these mutant variants are concerned. Your thoughts on these 2 points and your message.
I think what I would say is whenever your turn comes for vaccine, have it. That's number one. There is nothing about having a choice for the vaccine. All the vaccines are very good. So
Hmm.
that, don't say that I want to have this vaccine and I will only have when this vaccine becomes available. Number three is, as government has given it in
Hmm.
Supreme Court that all the population above 18 year will get vaccinated by December. And when we have 70% of population vaccinated, we will get a herd immunity. So what I am
Okay.
saying is, have a COVID appropriate behavior all the time, which we all keep on
Are
saying.
we
We
inching closer to the herd immunity then in that case, since you mentioned?
I think not at the moment, but
Okay.
we will inch forward. I think we
But
will
that's the
reach.
goal. That is the
Yes,
goal. Hmm.
absolute goal.
Hmm.
And what I feel, we will have a herd immunity by November. when 70% of the population will get vaccinated. And the vaccine production is going in a big way. So from next month, Covishield is going to start producing 10 crore vaccine a month. Covaxin is going to produce 8 crore. Same as, Sputnik. So a lot of things are coming. There are lots and lots of other vaccines coming as well. So what I'm saying is, till the time you are vaccinated, till the time country they have a herd immunity, please be very careful, have a COVID appropriate behavior, don't do anything silly. We all as a country are together, and if somebody get infected, have a mini sort of strict surveillance needs to be there. Test, track, isolate, treat, and contain. That is the most important thing, so that we don't have, the third wave, which is bad or bigger than the second wave.
Yes. Uh, okay. So mutations or no mutations, vaccination and COVID appropriate behavior has to be. It has to be. It's like writing on the wall, Dr. Rawat, that it has to be made part of our lives. And if you haven't done it, please do that. Thank you very, very much, sir, for talking to us on Doctor's Chat. Dr. Saumtira Rawat for joining us, recipient of Padma Shri Award as well, for talking exclusively to DD News and DD India. Thank you so much, sir. Namaste.
Thank you for inviting me. Thank you.